Hi, my name is Trisha Teeters, and I am a respiratory therapist, and I am going to demonstrate for you today the ABCs of CPR. First of all, CPR stands for cardiopulmonary resuscitation, and we're going to go over the ABCs of it. A stands for airway, B is for breathing, and C is the circulation. If you find somebody laying down on the ground and you think that they need help, then we are there to help them. The first thing that you'll want to do is to figure out if the person is breathing or not. There are several ways to do this. First of all, you can look for chest movement. And secondly, you can feel for any air coming in and out of the mouth. And you can also listen for any air whistling in and out of the mouth. And if you find that the person is not breathing, you'll want to make sure that you try and get an airway for them. We want to make sure that the head is in the correct position. You'll want to put your two first fingers on their forehead and your other hand underneath their chin, and you want to lift up. This way that the trachea is lined up straight and we won't have any obstruction of airflow into their lungs. Secondly, you'll want to figure out if your patient has a pulse or not. There are two ways that you can do this. You can check in their wrist, on the underside of the person's wrist, and then again you can use your first two fingers and press gently to feel for a pulse. If you cannot feel one in their wrist, an easier way to do it is also in the neck, and to feel for a pulse. If you cannot feel for a pulse in either the neck or the wrist, then you'll want to assume that their heart is not breathing and they've gone into cardiac arrest. The first thing that we'll want to do after we've found whether our patient is breathing or not is to give 2 rescue breaths. You want to make sure again that you have the head lifted and tilted in the proper position. And then you'll want to make a tight seal with your lips around their mouth. And you'll give 2 full breaths. And you'll want to make sure that you see chest movement to make sure that the air is getting into their lungs. If you do not see this, you might want to reposition the head again and try 2 more breaths to see if that has helped or not. And secondly, if we found that there is no pulse, we'll want to give compressions. The first thing that you'll want to do is to feel on their sternum and to feel where the little notches on the end of their sternum, where the last 2 ribs join. And that is where you'll want to put the palm of your first hand. And with your second hand, you'll put on top of that, and it's easiest to interlock your fingers. And you'll want to push. At this point, it is important never to completely take your hands off of the sternum, but you will want to release your hands off of the sternum so that it does relax back to its original position. The rate for this is 15 compressions to 2 breaths. Given that you are the only rescue personnel there, if there is 2 of you, then one person can do the compressions and the other person can give the breaths. And you always want to stop every few seconds and make sure that you are getting air in and out of the lungs, and also to feel if there has been a pulse brought back. If at any point the person does start breathing again on their own, or the pulse does return back, you'll want to stop. And whenever you're given your 15 compressions, you'll want to do it so fast that you get about 80 to 100 compressions in a minute, to ensure that the circulation is still moving throughout the body so that the oxygen in the blood gets through the vital organs and they don't have any damage. Now, if you are a rescue personnel and you can give the breaths, if you are not a medical personnel, then you can always do the hands-only CPR, which is the newest version of it, and that is whenever you just only do the compressions. You don't have to give the breaths. And you'll want to keep working on your patient until somebody else would arrive, or medical EMTs would arrive, or the ambulance would get there to help you. Okay? Is there any questions as far as the techniques of the CPR or the hands-only technique that I just shown you? No? Okay. Well, again, my name is Trish, and I'm a respiratory therapist, and we just went over the ABCs of CPR. Thank you.